Hi, and welcome once again. As you know, guys, that with age, your skin ages to at the same rate. And there's a time where comes the need to do the maintenance of your body and skin. And you find experts to solve your aging issues. 20 years ago, people were not really aware about aesthetic field and its medicine, and knowing only for the plastic surgery. But now, in present day and age, people knowing more about this industry and getting help through it, and it's doing wonders in beauty industry. But still, full information is not spreading. Maybe because it's a taboo, or people they're shy, they're secretive, they don't want to talk about it, or they could have fear of going undergo these procedures, though these procedures are so expensive. But what if something goes wrong? So, to unveil all these secrets and issues of aesthetic beauty, I have invited Dr. Fatima Bhabha in my show. So, let's get her on board. Assalamu alaikum, Dr. Fatima. Can you hear me?
I can. How are you?
I'm good, Alhamdulillah. What about you?
Very well. Thank you very much for asking.
Okay, so first of all, thanks a lot for joining. It's an honor for me that you joined and you availed yourself.
Thank you so much for having me. It's such a pleasure.
Okay, so let's start from this, when we age, our skin ages too, and sort of drooping down of our skin because of losing maybe elasticity. So my question is, how could we maintain it through certain procedures and can increase our skin age a little bit more than usual?
So skin ages, that is true, depending on the environment, where we stay, what pollution our skin goes through, how much of stress we put on our skin ages. Mm-hmm. So yes, we lose what we call elastin and collagen, and that's the elasticity of the skin. So if you pinch my hand, right, you can see that it moves quite more than if I had to pinch my face. Okay, and that's merely because elastin and collagen in my face has not degraded or got lost as much as the elastin and collagen in my hands. Mm-hmm. Okay, there are procedures that increase elastin and collagen in our body, and that's very good for us to do as we age. So people always ask, like, what age should you be starting, and what age should you be, doing things to increase your elastin and collagen? And the answer is pretty simple. As young as you possibly can, from the early 20s. Okay. In terms of treatment, that would come depending on your symptoms. Okay, so if you have sagging, or you have wrinkles, or you have a very soft, stretchy skin, then you need to start treatments earlier. Okay, there's a lot of that can be done. So the first one would be fillers. Fillers increase elastin and collagen in your body. The second one would be threads. So I'm not sure if anyone is aware of those, but those are like little stitches that we put to lift up the body. Mm-hmm. So there's two types. We get that is only to stimulate elastin and collagen. So those are lots of little ones. Mm-hmm. Those are very nice. Mm-hmm. And the second one is the one that we use to lift, to kind of lift the skin, and that gives us elastin and collagen. The third one is where you do hydrating treatments. Mm-hmm. So those would be microneedling, dermapen, mesotherapy, chemical peels, medium depth chemical peels. So those all also help to stimulate elastin and collagen. And obviously collagen powder, liquid collagen, bone broth, things that you can eat.
All right, so now let's discuss about some procedures cost, as women really like to invest in themselves, they want to look good. And so my question is it only like for rich or famous people, or there's something for everybody? So what would you say about it?
there's something for everybody. It really depends who you go to. Okay. And also, treatment is very area-based. So I will use myself as an example. I've got two practices. And the one is in a more upmarket kind of area, and the one is in a medium sort of area. And what you offer would differ. So I wouldn't be presenting the high-end things in my other practice, because it's to cater for a different need. So there is something for everybody. There's something within a range for everyone. Also remember, like you said, it's an investment in yourself, so you don't do everything at one go.
Yes.
A little bit at a time gives you a better result in the. So a little bit sort of all the time, that's better than everything at one go.
All right. So what would you say about, like, of course, a bit relevant to this question, what I asked earlier, that like quick root maintenance and like budget root maintenance? I've heard it before, so that's why I just brought it up in front of you.
So quick budget root maintenance is where you come in every month and you do something to maintain yourself in the long term. Those would be microneedling, mesotherapy, chemical peels, what we call laser tightening of the skin. Botulinum toxin is another one where you can put to get the result you want. Fillers are also like that. So instead of doing a full face of filler, you can always do your cheeks this month, and then you do your chin next month, you do your lips the month after that. Eventually you'll with a nice look, but you're not doing everything at one go. When it comes to maintenance, you also then maintain one thing at a time, and you will not be doing everything at one go. Skincare products, very, very good for maintenance because they hydrate, they all the nutrients you need. And the other one, which is very cost effective and a good maintenance, are chemical peels. Chemical peels are like lungs, chemical peels to your skin. You just like you breathe, you need to do chemical peels on your skin. It's not something you must, leave around and not do and things like that. Not just your face. So when I talk about skin, I'm talking
neck area
this is
as
your
well.
face. So
yes,
ear to ear, and your hands are important. So people tell your age not from your face; it's from your neck and your hands. That's the place 90% of people don't treat.
Yes,
and those are the that age the fastest.
Right. Okay. So now let's talk about the basic and the major problem of ladies, and that is acne. So what type of procedures do you offer for acne?
So acne is a multi-dimensional problem. It's not just a skin issue. So it's what you eat, it's your hormones, it's also what kind of products you use, whether your family members have had acne before. So is it hereditary? Is it something, that's stress-induced, and so forth, we treat. Now, I believe a person with severe acne, so remember, you see your doctor once or twice a month, but whatever you put at home, you do every day. So a good skincare product is better. Then a retinol. So a retinol is something you take orally or something you put topically onto the skin.
Right.
So if everyone is familiar with, the most common one is Roaccutane. That's the oral acne treatment. Okay. It comes with a lot of side effects. So it's only used in extreme cases. All right. Then we talk about lasers are very good to treat acne, but there are only specific lasers that work for acne. So those ones. The other one that we use a lot would be chemical peeling, but especially for acne skin. So you get something called Acne-Lan, you get glycolic acid peels, salicylic acid peels. Those are targeted for acne. Chocolate is not acne, sugar is not good for acne, caffeine. Good. So those are things that you need to, monitor. The other thing is that there's different forms of acne. You get teenage acne, you get adult acne, and then you get menopausal acne. So obviously those are based on your hormones. So you need to check your hormone stages of life. A good skincare routine, exfoliation, masking. Those are also important things. But acne is mostly treated by your aesthetic physician or dermatologist because they will guide you so that in the long term, you don't end up with acne scarring, as that's very hard to treat. If you end up with acne, those are very hard to treat.
So do you think like maybe, somebody just continuing for the long time of period and of course going to visit the aesthetics. So do you think that there will be kind of solution to maybe a bit like, fading up those scars, or like, you think so that no, there's no solution?
No, there is solutions. It just takes really long.
Okay.
So people need to be patient to get a result overnight. It requires more than treatment to get a result. So yes, there are solutions, but as a doctor, we need to prevent the scar. So the earlier you treat acne, the better for you.
All right.
And the scars are treated, but they take it's a long process, and the patients or the clients need to be patient, and you need to understand that it's one type of treatment that's going to treat it. It will be a chemical peel, it will be a laser, it will be a different type of laser. So it can be fractional laser, it can be pico laser, it can be carbon dioxide, nitrogen, just depending. So we use a few different things. We can also inject filler into the scars. So it's a lot of treatment, but yes.
Okay.
It just takes long.
All right. Now, what about chin enhancement? Is it a painful procedure, or like, you think so? How many sessions would somebody go, for this procedure for chin enhancement?
Chin enhancement is not a painful procedure. Chin enhancement generally is done in one to two procedures.
Okay.
Remember, you have to do maintenance once a year. You'll need to revise your chin. So chin enhancement, we just inject here, sort of here and here to elongate the side.
Okay.
So one treatment generally, and if it's a lot of filler, then two. But more than that, no.
Okay. All right. Okay, now about, all right. Can you hear me?
Yes,
hello?
I can.
Okay.
Hello.
Now, yes, I can hear you now. Okay, now about crepey eyes. It's also a biggest issue, of aging, and if proper care has not been taken, for maintenance. So what do you think about it? And what's the best solution in regards, or, any procedure you would recommend for this?
Crepey eyes, the best treatment is PRP. So protein-rich vampire facial, where you take the blood, you spin it down, and then you inject it back. That is the best treatment. Or a nitrogen plasma. It's a nitrogen-based plasma that gives you a very good result. So those are the two options for crepey skin. Now remember, crepey skin also needs a good eye cream, good pair of glasses, and long-term maintenance as well. So you can't do 2 or 3 sessions and expect the crepey skin to be gone. You need to do a few sessions. You need to maintain every 3 or 4 months, but good results. Crepey skin is a very big problem, especially in old age. Also, baggy under eyes is another big problem. So yeah, those are the solutions. Yes.
Okay. And about the turtleneck, can it be treated? And same like about double chin as well.
So turtleneck, remember, if it's very bad, so if it is really saggy and really bad, then a neck lift is your best option. So that would be surgery. Okay, so that where they go, cut out the skin and they stitch it back, that would be your best option. If you are young, in your is 45 or so, and you're starting to get the turtleneck, then you start with treatment. So the same. It's to stimulate elastin and collagen. So all the procedures that stimulate elastin and collagen will help with the crepey neck. Threads are really very good because they stimulate elastin and collagen. Using some filler is also very good, and lasers are very good for a turtleneck. But remember, turtleneck, when it is very loose, when the skin is very, very loose, then your best result is to do a surgical procedure for the neck. Double trim. So double trim, you get what we call lipolytic injections. Those are injections we inject into the fat to get rid of that from the double trim. We can also use what we call rebounding threads to help the face get more contour. You can inject filler into the mandible and chin, so that takes away from the double chin. It just makes your mandible look better and then also radio frequency works very nicely for the double chin. Radio frequency, fat removal injections, liposuction also for the chin, double chin works very nicely. So those are the double chin options.
Okay. So okay, so Dr. Fatma, as this is just a first session I'm having with you. Probably we're going to discuss in other few sections also, different things in full detail. It's because what I'm asking, you are telling me something, but of course, there's a little bit need of giving more details, which probably we wouldn't be able to cover today, but definitely, we'll just keep on doing more sessions and then we're going to discuss a lot more about it. So the next question is yes. So the next question is that's related to the treatment you people offer, and you offer especially with your sisters. So which procedure you think that extremely expensive and why?
I must tell you, there's a range of procedures. Like the most expensive would be a hyaluronic acid thread lift.
Okay.
That's the most expensive treatments we have, and that's because it's the best option on the market. It lasts for the longest period of time and you get the best results from it.
Okay. All right. So what would you say about marinette lines and droopy cheeks? So what do you offer this for droopy cheeks?
Let me explain something, right? So ideally, the treatment options are not very vast. So it will be a thread, it will be a filler, it will be Botox, it will be, those are the things that we use for saggy, crepey, droopy. Right. Anyway, it's how it's put in and how it lifts that differs. So in every area, also which thread you use. Remember?
Yes.
I lost you there.
Now I can see you now.
Because remember, yes. You lose it's how you put it in, and every area is a different type of product that you will use. So even though it's the same option, it's a different product. It's size, it's a different quality, it's a different type. So when we go into depth of each treatment option, then I can explain to you better what is it that we use. I can also show you some options, and then we can give the followers something to know what they can choose or not choose.
Okay, so what is this something we call Nano Fat? If you can explain a little bit about this.
So Nano Fat is really nice. Nano Fat is called regenerative medicine. So you take fat from anywhere on the patient's body and you make stem and you use it to regenerate any other part of the body.
All right. Okay.
That is what. So if we were using filler or threads, that is substituted with a nano fat. So you take nano fat from somewhere in the body. You will then make stem cells from the fat and inject it back. So nano fat is more regenerative medicine and more anti-aging. So it's more to cause anti-aging and regeneration.
Okay, so do you do the liposuction treatment as well? Do you offer?
So we do offer liposuction, but it's the GP-based liposuction. So it's the one that we went for training for. We don't do fat transfers and we don't do tummy tucks. So we only do liposuction.
All right. Okay. So let's just talk about a little bit invasive, which is a permanent solution. Hello, are you there? I think my guest is having some signal issues. So never mind. I would invite her again for the new session. And my dear viewers, till then, take good care of yourself and gonna see you soon. Bye bye.